Nurses in the Philippines. Overwork na nga. Underpaid pa.
The nurses in the Philippines are known to be overworked and underpaid, which is why they leave the country for better opportunities. The patient-to-nurse ratio in public hospitals is 2:60 despite the ideal 1:12 of the Department of Health. On a regular day, nurses work beyond their 8-hour shift to endorse all their patients without getting paid for their overtime service. Even though the Philippines produce a high number of nurses, it clearly shows that the country is not providing enough for these healthcare professionals to practice their expertise in the country.
Despite all the hard work that our nurses do, their salary barely makes up for it. Considering that they save lives, it is quite glaring how poorly compensated most of them are in our country.
According to the Department of Labor and Employment, in the local labor market, an entry-level registered nurse receives a salary of 8,000 to 13,500 per month. Registered nurses hired at hospitals commonly receive an average salary of 9,757 pesos per month.
As compared to other countries, the Philippines are way behind in terms of compensation. In the United States, the average monthly salary of a registered nurse is $3,800, which is roughly 200,000 pesos in the Philippines.
Here is a testimony from a Filipino nurse who had decided to quit working in his own country, explaining his experience towards the situation.
First reason why I quit nursing is lack of opportunity. Okay, siguro 2000 to 2010, there were so many nurses. Everyone was taking nursing. And maybe that's a bad thing. Maybe that's not wise. But ang sigurado ako na bad thing is how the healthcare system and the government took advantage of that. The second reason is lack of respect and misconception of the nurse's role. Sa mga Pilipino po, utang na loob, hindi nyo po katulong yung mga nurse. May lisensya po sila, nag-aral po kami, nag-take po kami ng board exam, pinasa po namin yung board exam na sobrang hirap. Sacrifice, nursing is a sacrifice. You have to do night shifts. Personally, I can't do that. I throw up. I need my sleep. I'm a regular person. Nurses are superheroes. There's always a safety hazard as a nurse. Pwede nila makuha yung mga sakit ng mga patients. That's why I'm saying it's a sacrifice. Lack of passion. Madami kang dapat ibigay. Madami kang dapat matutunan. Every time, even if you're already working abroad, every time you move to another country, you have to take the licensure exam. That's tough.
Unfortunately, unjust labor conditions is a major issue that occurs throughout centuries, that even Pope Leo XIII wrote an encyclical about it, entitled Rerum Nurvarum. Written in 1891, Rerum Nurvarum advocates for social justice by defending the workers' rights which were exploited by employers at the time.
Currently, nurses in the Philippines are experiencing the same form of injustice. As Filipinos and future Tamasha nurses, it is our responsibility to call out the injustice that would otherwise be our future. Thus, we have created the Rerum Nurvarum.
First, we have the just wage for nurses in the Philippines. It is the adjustment of the entry salary rate of registered nurses to meet the required minimum wage of any worker in the country. Also, it is to compensate work hours through payment of overtime services. After that, we have reasonable nurse-patient ratio. It is to follow the ideal 1:12 nurse-patient ratio given by the Department of Health or DOH for better working condition in both private and public hospitals.
Solve staff shortages in hospitals. Most hospitals are understaffed despite the abundance of registered nurses in the Philippines, affecting the overall work conditions vital for patient treatment.
Nurse appreciation. Nurse shaming is still evident in some areas, and nurses are unmotivated to do their job because of the toxic work environment and not because they are incompetent.
Most of the hospitals that Filipino nurses work in aren't even conducive for proper health care. For example, patients are tightly cramped in areas where there's barely any room to move around in, which delays the delivery of quality health care.